Hi, I'm Chris Lester, President of Professional Planning Services in New Jersey, and I've been helping families and the community for over 30 years to help get their affairs and questions answered as it comes to retirement. Today's topic is going to be on what does Medicare cost? So without further ado, let's get started. So how much does original Medicare cost? Now, this presentation is not designed to be a complete deep dive on Medicare, but you should understand some of the basics. It's a great question, and the short answer is it depends. So let's look at some of these basics that determine the cost. So Medicare overview, you become eligible for Medicare at the beginning of the month that you turn age 65 or earlier if permanently disabled. Now, Medicare Part A, it helps you to cover the cost of hospitals, limited nursing facility care, hospice care, and limited home health care. Medicare Part B is what I refer to as the doctor's component. So that helps pay for doctor's bill, outpatient treatment, emergency room, ambulance service, diagnostic tests, laboratories tests, durable medical equipment. Now, Medicare Part C is a combination of some type of an insurance plan, typically called an Advantage plan, coupled with a Part D, which is a prescription drug plan. And again, as I mentioned earlier, this isn't intended to be a deep dive on Medicare and all of its working. You can attend one of our upcoming events or watch other YouTubes that we're putting here on this topic. But we wanted to help you to understand what the actual cost of Medicare is so that you can make informed decisions on the supplementary or additional coverage you may need for healthcare. So what is Medicare? Right? Put simply, health insurance. It's health insurance administered by the federal government. Parts A and B are what we deem original Medicare, and it's not free. It primarily works in the United States. Part A helps to cover the cost of hospital care. And the key word here, limited nursing facility care, hospice care, and limited home health care. So I've broken these sections down. We'll go through each area. So hospital coverage, right? There's deductibles. Should you have an event where you need care inside of a hospital, there's that deductible, $1,556. Then they start counting the days that you're in the hospital. For the first 60, there's $0 coinsurance for each benefit period. Days 61 to 90, there's $389 coinsurance per day. So that can add up pretty substantially. And then days 91 and beyond, it's $778 coinsurance per each. And then lifetime reserve day after day 90 for each benefit period up to 60 days of your lifetime. Like I said, I'm not going to get into all the internal workings today, but that's a mouthful right there. And you need to understand that, in short, the hospital coverage, if you have an extended stay, it typically can have a lot of holes in what it covers, and you could be faced with very large looming medical bills. Now, the next area, skilled nursing, this is not the same as nursing home coverage. And this is a key definition of how a lot of hospitals, or what is actually paid for, is skilled nursing required. So you pay with original Medicare. Days 1 through 20, it's $0 for each benefit period. Days 21 through 100, it's $194.50 coinsurance per day of each benefit period. And then days 101 and beyond, all costs. So in that case, it can pick up some significant coverage initially, but at the end of the day, at days 100 on, you're paying for all of this. So keyword there, you pay with original Medicare, X amount. And then from there, it gets astronomical. Hospice, respite care. So nobody wants to think about passing away, but should you go to the hospital and, they deem that you're in your final stages, quite often you may be moved to your home or some facility, and they will bring hospice in to take care of you. You pay nothing for hospice care. You pay a co-payment of up to $5 for each prescription for outpatient drugs and pain and symptom management. And you pay 5% of the Medicare approved amount for inpatient care. And then lastly, some home health services. This is really, really important. $0 for home health care. And, we ask this question quite often is, if you were to be sick, where would you want to be taken care of? Would you want to be at home, or would you want to be taken care of in a nursing facility? And I think in excess of 88%, probably closer to 90% of people will say they would prefer to be taken care of at home if possible. Well, home health care is not being paid for by Medicare. And then 20% of Medicare approved amount of durable medical equipment after you meet Part B deductible. So Medicare Part A cost. So most people get Part A for free, but some have to pay a premium for this charge. Very few. I have not run across anybody. But to be eligible for premium-free Part A, an individual must be entitled to receive Medicare based on their own earnings of those of a spouse, parent, or child. To receive premium-free Part A, the worker must have have a specified number of quarters for coverage, QCs, to file for an application for Social Security or the Railroad Retirement Board. The exact number of QCs required is dependent on whether the person is filing for Part A on the basis of age or disability or end-stage renal disease. QCs are earned through payment of payroll taxes. Under the FIC, you probably always wondered what that meant or was for. On your paycheck, we get debited every pay period. It's Federal Insurance Contributions Act, or FICA. During the person's working years, most individuals pay the full FICA tax, so the QCs they earn can be used to meet the requirements for both Social Security benefits and premium-free Part A. Certain federal, state, and local employees pay only Part A portion of FICA tax. The QCs they earn can be used to meet the requirements of premium Part A. They may not be used to meet the requirements for monthly Social Security benefits. A little more technical than we need to, but it's out there. So long-term care, and I put this slide here because it's important, is not covered. That goes back to that skilled nursing. So the statistics vary, but they all indicate that you are likely to need long-term care. Approximately 70% of those Americans who live to the age of retirement will need long-term care services at some point in their lives. 42% of people in need of long-term care are 64 years and older. So it's just long-term care is an area that we absolutely will talk about on other, venues, other YouTube videos or public events. But just understand, if you've experienced it firsthand, either with a loved one or a parent, grandparents, then you understand how accurate these statements are. Part B comes with a monthly premium based on income. It has a deductible of $226 in 2023 and 20% coinsurance. Remember, Part B is for doctor's visits. There's no cap on maximum out of pocket. So each year, the Medicare Part B premium, deductible, and coinsurance rates are determined according to the Social Security Act. The standard monthly premium for permanent Part B will be $164.90 for 2023. It actually dropped a decrease of $5.20 from 2022, which was at $170.10. The annual deductible for all Medicare Part B beneficiaries is at $226. And then it's a decrease of $7 for the annual deductible of 2022. So what Part B typically covers, again, this is the doctor's component, and skilled nursing, right, needs to be required, but it covers physician services, outpatient hospital services, certain home health services, durable medical equipment, and other medical and health services not covered by Part A. So again, think of Part A as hospital, Part B as doctors. Now, here's the part where, we talked about what it costs. And so, As a financial advisor, sometimes one of the strategies we'll talk about is as we enter into retirement, we're looking at people's overall finances. And as they either start to have the ability either to make money, cash out stocks, maybe do Roth conversions, maybe get an inheritance, selling out investments, all these things play a factor because Part B is income means tested. What is the income related monthly adjustment amount? That's a mouthful. So we call it IRMA, IRMAA. And it's for high income Medicare beneficiaries. And that's a little deceiving because again, obviously, if we're in retirement and it's, your total income is below the $97,000 or $194,000 if married, you'll pay the $164.90 for 2023. However, part of the strategies that I see a lot of financial advisors talking to their clients, and we've helped quite a few families do Roth conversions. There's a 2-year look back on income when determining the IRMA. And so we have to be cognizant as we're trying to convert, remember that the IRS allows you to take some of your qualified plans in your 401k or IRA or 403b or TSP, maybe start to convert that to a Roth. But when you do that, that now counts as income in that year. And if you're not careful, you will get hit with a hefty Medicare Part B premium. Now, Medicare Part B is paid to or from Social Security from your Social Security check. What do I mean there? So once you file for your Social Security, so if you're at full retirement age, maybe you decided to collect early, 62. Well, then you're getting a check. The premium would be paid, and it would be a reduced check from your Social Security. But if you went to full retirement age 67, and to get the maximum Social Security that you felt you were entitled to, that if you took it and for 2 years at age 65, Part B has to be paid. So they will send you a bill and you have to pay that. So now to the IRMA component. If there was an increase because you were doing Roth conversions that bumped your income to these higher levels, and let's say it was greater than 306 for a married couple or equal to 366. So that's a premium of 428. And that's per person. So, that could be a hefty amount of reduction of income into a household. So just understand that there's a 2-year look back for IRMA. But the other component is it is not permanent, meaning that if in your strategy that you do get an increase, and in the form of Roth conversions does bump your Medicare premium up. Once those conversions are finished and we get past that 2-year completed look back period, that the government will adjust your future Medicare premiums to the lower amount that your income qualifies for. I got a little deep there, but I just want you to understand that IRMA is something that you may hear about, maybe not quite understand, but it really just depends on your income. And then the other thing is if maybe in the year that you retire, you decide that you want to appeal it because you're not actually going to be making that much because at the time that you retire, again, they were basing it on your income 2 years ago before you were retired, and you're getting whacked. So if your income 2 years ago was higher because of your working at that time, now your income is significantly lower because you're retired. Work reduction, work stoppage, you can appeal the IRMA initial determination. The life-changing events that make you eligible for an appeal include death of a spouse, marriage, divorce or an annulment, work reduction, work stoppage, loss of income from income-producing property, loss of reduction from certain kinds of pension income. So the appeal can be done through the Social Security Administration by filling out that form SS 44. So again, it's just something that you need to be aware of as your approach. Dealing with somebody that's familiar with this stuff, we can help you navigate your specifics. Now, what Medicare Part A and B do not cover long-term care, routine dental, routine vision, hearing items, gym membership, and prescription medication. So additional surcharge Part D, this is the other component. So Part D is for drugs, but IRMA is also applied there. So income, just like on Medicare Part B, if you are in need of drugs and your income is elevated, you could find that your premium for that is also increased. So professional help should be considered when strategizing income because of the means testing. So you are not alone. So I'm Christopher Lester, happy to answer any question. My staff, Caitlin Urchik and Keith Lester, we're all very knowledgeable. We don't know everything, but we're happy to help. We do have the resources, the skill sets to get you the answers that you need to be able to help you to put in place and understand what your costs of putting Medicare Part A and B, and then if you need C and D as well. So get professional guidance. If you like this video, please click and share the link below. That'll be below here. And then you can schedule a meeting by calling us at 732-302-1810 or visiting us at our webpage, which is professionalplanningservices.com. I want to thank you again for watching and have a wonderful day.